All right. So Matthew and I got our wearable heart rate measurements accurate to estimate aerobic energy costs during low intensity resistance exercise. This is an article published in 2019 by Reis et al.
To summarize, the study's aim was to assess how accurate heart rate monitors are in low intensity training, with heart rate and energy costs as the dependent variables of the study. 56 volunteers participated in 8 different resistant training exercises and wore heart rate monitors and measured VO2 output. The results of the study proved that heart rate monitors are accurate enough to estimate aerobic energy costs of low intensity resistant training. Authors explain that knowing how many calories are being burned can benefit athletes, bodybuilders, and the geriatric population to avoid overtraining and benefit or assist losing weight.
As far as the title for this paper, the title is pretty lengthy, but the length is not inappropriate. All the words that are used are very relevant to the study. Because they're all relevant to the study, it tells us exactly what the paper's about, but doesn't give away any of the findings of the study. And like I said, it only tells what the paper's about, nothing more, nothing less.
The abstract describes that the participants are very briefly described, with 56 male between the ages of 22 and 34. The procedure is roughly laid out with 4 groups of 14, 2 exercises, 4 minutes each. The intensity dependent is on 1 rate maximum. The exercises were half squats, incline leg press, leg extension, bench press, incline bench press, lat pull downs, tricep extensions, and bicep curls. Not a lot of detail was talked about on the findings, but the authors conclude that it is possible to estimate the cost using wearable technology.
As far as the introduction and review, there is background information provided that says that there is not a consensus on the most accurate way to estimate caloric energy costs using heart rate and low intensity exercise. Because low intensity exercise is becoming more popular in all health areas, it is important for researchers to understand the associated energy expenditure levels. Low intensity exercise is becoming popular with, rehab settings and in bodybuilders and athletes now as a way to be able to train without overexerting anyone. And the present study aimed to test the accuracy of wearable heart rate monitors when being used to estimate the energy cost associated with low intensity exercise.
The methods were 56 males volunteered, and they were between the ages of 22 and 34, with three sessions of resistance training per week for a year. Characteristics of the volunteers were presented averages, heights right there. They excluded those who did drugs that could potentially affect the cardiorespiratory response systems, which gave more validity to the study.
Appropriate instrumentation was used in this study. The only thing that I might change is they decided to use skin fold calipers as a mean to calculate body fat percentage. That is considered to be a pretty accurate way to measure things if you get the same researcher doing it and you know that they're very thorough in the way that they're doing it. But there are other ways. They could use a DEXA or hydrodensitometry or something to potentially get a more accurate measurement. They used a K4B2 device to measure expiration and a Polar V800 wearable heart rate monitor. I don't know enough about any of these things to argue whether or not there would have been a better device to use in this particular setting.
The methods, the key variables are controlled for what? Oh, I was just reading that. Key variables were the heart rate monitors and the energy output. They advised the participants not to do anything that would possibly affect the measurements of their out rate or their heart rate, which the Valsalva maneuver where you're holding your breath to lower your heart rate was asked not to be used to accurately measure how the heart rate monitor catches. The time and day and weather were controlled for. Um, the bias is not likely. Only volunteers, and they limited the drug use, the gender, and training history to present a more accurate or a more similar participant.
The results showed a very linear relationship between heart rate and energy cost of exercise with a relative error at or below 10%. And there is validity to this, as the authors mentioned, the previous studies and the previous studies' ability to change the results that they were getting based on the change of exercise intensity. And you can see that the percent 1 rep max increases. So the more intense the exercise got per person, the less correlated the heart rate findings were with the energy cost of exercise.
In the discussion, the author finds differing levels of correlation depending on which body part was being exercised, theorized that the size of the muscle group being exercised leads to the correlation difference. Main conclusion is that the wearable heart rate monitors are effective at estimating the expenditure of LIE, supported by the correlation between the VO2 levels, the heart rate monitor results, and the expected caloric expenditure. Remember that the 10% error in differing levels correlation between the muscle groups was fluctuating. So it wasn't just 10% through it all, it was 10% below.
Low intensity exercise is used in many populations, and authors believe that it can benefit all of them. As I mentioned earlier, athletes and bodybuilders both train at some point in the low intensity exercise area to avoid overtraining, or, with bodybuilders and stuff, they have tapering days as they get closer to show days. It can also be used in rehab. Somebody who's coming back from an injury, you're not going to have them go super hard when they first, get back in the gym, or when they're first going to physical therapy. And then with geriatrics, low intensity exercise is a great way to keep them active without risking any injury. And this is also being able to correlate heart rate to energy expenditure is good when you think about being able to track calories in versus calories out.
Overall, this paper is a significant contribution to science. It can be used by many different populations, athletes, physical therapists, and even bodybuilders, and it can lead to further research to employ use at a higher level, especially in athletes. Using this at high intensity training sessions or high intensity interval training can benefit those populations just as much as bodybuilders who are looking to measure how many calories they're burning. It argued against previous research saying that wearable heart rate monitors were inaccurate to calculate the energy expenditure. This was definitely proven wrong with the results here, and with the errors being below 10% at different muscle groups.
And here's the citation from the paper.